Singapore is preparing for the next COVID-19 wave at the year end, which could be driven by reinfections of the virus. It's looking to increase its telemedicine capacity by over 6 times to almost 10,000 consultations a day. It will also more than double the number of beds at transitional care facilities to more than 360, and that's by the end of the next month. Melissa Goh tells us more.
The Northern Hemisphere is gearing up for a wave of COVID-19 infections this winter. And Health Minister Ong Kang says it too may hit Singapore's shores in a few ways.
One scenario, nothing happens. That would be good. 2 is we have a wave, but it's another Omicron wave. In which case, I think we can be quietly optimistic. Given that we just emerged from BA.5, chances are you will have good immunity and protection. But what if year-end wave is another VOC? Something totally different, non-Omicron, great immunity escape. Then I think let's prepare for the worst.
Authorities are preparing to meet it with expanded vaccinations, increased healthcare capacity, and safe management measures. They're converting part of the Changi Exhibition Hall to treat both COVID and non-COVID-19 patients, having found that many who were warded in the recent infection wave fell into the second group. An expert says the year-end situation will depend on how the virus evolves.
Genetic changes are going to continue. That's a fact of life. It's a question of whether they emerge into something that's more transmissible, more severe, avoids the vaccinations, these types of things. That's what we can't say.
While he feels imported cases could be inevitable, people can take steps to protect themselves.
We really have to allow normal life to resume. So I wouldn't really suggest people place travel restrictions on themselves. But people can avoid high-risk situations when they're travelling and when they're in Singapore.
Professor Fisher says how these cases spread will also depend on immunity from vaccination as well as prior infection. So far, 7 in 10 people have caught the virus in Singapore. The Health Ministry says they are closely monitoring reinfection numbers to see when the next wave could happen. A good sign, though, is that the chance of catching the virus again 8 months after being infected hovers at a low 5% of someone who hasn't been infected before. Mr. Ong says the move to ease up on measures like mask wearing was taken in view of the big picture, but this could change.
If we need to put back our masks, even impose more strict SMMs, let's be mentally prepared to do that. Which is why it's important for us to now take this move of removing masks. Because if this turns out to be a long battle, then we need to step down rules and we don't need them. So that we keep faith with the people. When the rules are not needed, we step it down. When they are needed again, we ask for the cooperation.
With borders reopening with a bang, the task force also urges people to be flexible with their holiday plans, as the COVID-19 situation worldwide remains highly fluid.